NHS trusts in England have reported a combined financial deficit of nearly £1 billion. That's almost double the amount they had planned for. The regulator, NHS Improvement, said the service had endured its toughest winter in a decade, with increased patient demand, especially at A&E departments. Ministers have promised a new long-term financial plan for the NHS, which is expected within weeks. Here's our health editor, Hugh Pym.
The figures covering hospital, ambulance, mental health and other trusts in England show the finances getting worse. The regulator NHS Improvement said a surge in patient demand had affected performance in key areas, including waiting times. More than 2,600 patients were waiting longer than 12 months for non-urgent treatment in March, a 75% increase over the year. The regulator said hundreds of thousands more patients than the previous year had been to A&E, but the NHS didn't buckle under pressure. Today's report says that NHS trusts in England had planned for a total deficit of £496 million for the financial year, which ended in March. But the actual figure was £960 million, higher than the £791 million the previous year. Some analysts argue the underlying position was even worse.
There's a lot of window dressing in today's figures, which are bad enough on the face of them, but they are flattered by very large amounts of one-off emergency funding, which will not be available in future years, one-off savings, and also one-off sales of land and property that the NHS has managed to find last year. Obviously, you can't sell a spare hospital building every year.
NHS leaders argued there were significant challenges for the service, creating intense pressure on hospitals and other trusts and their staff.
We've got rapidly rising demand, so 3.5% more people coming to A&E every year. We've got really big workforce shortages, 93,000 vacancies, and we're in the middle of a very long and deep funding squeeze. So there's a real issue about the pressure that the NHS is under. If you think about those pressures, actually it's quite a good result, but we now have to do something to put the NHS on a long-term sustainable footing.
The Prime Minister says she's planning a new long-term strategy for NHS funding in England, and that's expected within weeks. Hugh Pym, BBC News.